A new health warning for women is just out this morning. The study shows the rate of cervical cancer in the U.S. is more than 50% higher than previously thought. It's even more common among older women. Dr. Tara Shirazian is a gynecologist at Mount Sinai Hospital in New York. Good morning, doctor.
Good morning.
Okay, this is a huge revision. Why were these numbers so off the mark?
Well, the study actually looks at removing the women who had hysterectomies performed in the United States from the population of women in which rates of cervical cancer are detected. So, meaning all the women who had hysterectomies in a given year were removed from the denominator number, thereby making the rates of cervical cancer higher.
Okay, but in plain English, are the rates of cervical cancer higher than we thought, and why?
Well, the rates are higher among certain groups than we thought previously. And the reason is that many women in the U.S. have hysterectomies, about 20%. And so those women often do have their cervix removed. And so their rate of developing invasive cervical cancer then is less, decreases.
And those groups you're talking about are older women, so I want to know what you mean by older and by black women.
Right. So the study actually looked at age as one specific risk factor for development of cervical cancer and for having hysterectomies. And both those two things increases as women age.
What's the age?
So over the age of 50 to 65 was really the group. And then they even noticed a second peak in women over the age of 70.
And what about African American women?
African American women, the rates were higher in that particular group, but again, that was probably because the rates of hysterectomy were higher. And we know that African American women do have higher rates of hysterectomy related to fibroid surgery. So it's not completely, unknown that African American women do have higher rates of hysterectomy.
And cervical cancer is caused by HPV, right?
It is caused by the HPV human papilloma virus. It's the cause, and there are other
sexually transmitted disease.
A sexually transmitted disease that actually we screen for in the office now. ACOG recommends that women between the age of 30 and 65 have PAP plus HPV co-testing every 5 years now. So it is a test that we do routinely.
So what should change because of this?
Well, I think women as they age should be sure to come into the gynecologist and get annual visits and checkups. I think risk factor-based assessment needs to be done for each patient. So every woman that comes to see me in the office, we do an individual risk assessment. Has she ever had an abnormal pap smear? Does she have HPV? Has she ever had HPV? Has she ever had any surgery to the cervix from HPV-related disease? Those sorts of things should go into continued monitoring of the individual woman for cervical cancer.
Thank you.
Thank you, Dr. Shirazian.